We've been doing these webinars for 3 months or so now, predominantly, well, all of them by Paul Silly. Hello, Paul.
Hi, Steve. How are you?
I'm very well. You okay?
Yeah, I'm fine, but I'd just like people to know it wasn't a joke I was telling. You were rabbiting on about some breakfast you had somewhere. There was nothing about a joke, I guess.
I did ask for that. You have dropped me in it now. So, listen, we've been really grateful to you, Paul, the last few months in these difficult times. Really stepped up for us, and we've done some great webinars. Guys, I've got to say this. I'll drop the link on this chat, and I'll make sure it's on the email when we send the certificate for today out to you. We've got a whole load of webinars that we've recorded that Paul's done for us the last few months. All free, all available to you all, probably 25, 30 hours worth of free CPD there, guys. Have a look at it. Keep learning, keep using laser, get better outcomes for your patients. Dare I say it, get better revenue into your clinics. So lots of resources there for you to go to. So please do take me up on that. I'll make sure you get the link for that. So that's a big thank you to Paul for that we've got that's out there. But Paul, you can relax a little bit today, although it might be needed for Q&A as well. But we're going to go and talk to Adam now. Adam, hi, how are you?
Not bad. I think it's the first time I'm on time for one of these, so that's a nice start.
Good. Brilliant. Okay, so listen, we're delighted to introduce Adam Smith of Adam Smith Podiatry and Healthcare. Adam is a user of our laser, and he's going to talk to us about wound healing. He's prepared a presentation for us, a number of slides we're going to go through. Before we do that though, I'm just going to have a little conversation with Adam and ask him one or two questions about the laser in general. So Adam, you've got the laser. How long have you had the laser?
We got it back in October, sort of end of October, start of November last year.
Okay, brilliant. And why laser? Why this laser?
I always like to try different things, to be honest. Nobody around really had the laser, so it was yourself at Oslo. We had been chatting in advance because I was having a look about differences between all kinds of things, shockwave, laser. Laser, because it had sort of a broader range of things that it can actually do, kind of appealed to me more. So spoke to yourself at it was the foot and ankle show the other year. So yeah, foot and ankle show, not Oslo. You know, you've done very well showing us it. We got it up for a couple of weeks and everybody absolutely loved it, from patients to ourselves, and it just seemed silly not to buy it in the end. It has been probably the best addition to our clinic so far.
Right,
Apart from the tea.
Apart from the tea, absolutely. Well, that's great to hear. I mean, how often would you use it typically in a day?
Well, this morning we've had, between the 3 rooms, 12 patients in and 5 have had laser.
Wow, brilliant.
Yeah, we use it constantly. The other day, all 4 of us at the same time needed the laser. So it was a bit of I'll put some acupuncture needles in while Jill finishes up. And, you know, we made do until we could all have a shot of the laser. So yeah, it's getting more and more popular.
So what you're saying, I take it the whole team use it, right? It's
everybody.
Yeah.
Brilliant.
Brilliant. Everyone bought into it straight away. Training was good, easy.
Oh, training was brilliant. Paul was up. Very easy to get us on hands with it. He got us using it very quickly. We all really taken with the laser very quickly. It worked. From pretty much the get-go, testing it on whether we all had little injuries and niggles ourselves, and trying to make sure things were pain-free and using it on patients. And it's just expanded over time. Wound healing was one of the first things we actually started using it for, and the outcomes have been excellent. So it's not been hard to sell to the team. The team have really ran with it.
Brilliant. Good for you. That's great. And one final question, actually. You just introduced the Ultra Head, the Charlie that we might refer to.
Yeah.
That made much difference. I know it's early days, but that made much difference?
Huge amount. When we are talking treatment times, if we're doing something such as a knee or sciatica, so lower back, the times have reduced quite a bit, usually knocking off maybe 8 or 10 minutes per session over what we might do, depending on
brilliant.
all kinds of things. So, I mean, over the course of a day, you're really freeing up probably an extra appointment. I'll cover a little bit more about the trial ahead in the presentation.
Cool. All right, yeah. I'm jumping ahead as well.
That's fine. Yeah, that's okay.
Anyway, you're warmed up now. Let's hand over to you. You share the screen now. So you take over the presentation. Quick reminder to all the audience out there: pop your questions on chat to me. If we could ask you to kindly stay on mute, that just really helps us. Go to speaker view. You should see the slides that Adam's now sharing with you on big screen. I'll put myself on mute so it doesn't interrupt anything. But if I've got any questions, I'm going to jump in, Adam. I'll try and get your attention, but we'll try and hand it over to you. And thank you very much. We'll talk in a bit.
That's all right. So yeah, I'm Adam. I'm a podiatrist. So graduated from Queen Margaret in Edinburgh in 2009. Over that time, I basically went into the NHS, and when I graduated, I worked about 5 years as a part-time on the hospital wards as the only ward podiatrist, which was a lot of wound healing, a lot of complex care issues. Initially, I was 3 years more routine, bit of nail surgery, MSK, that kind of thing. I wanted to set up a clinic on my own all the time. I've always dreamt of having my own place. So when I went part-time, I just opened a little dom business. That kind of got to the point where I had to open a clinic. We opened the clinic in March 2018 with my partner Joanna. Now we have 4 full-time podiatrists as of this Monday coming, and 1 part-time podiatrist with 2 part-time admin support. So we always look for ways to develop and expand in the clinic. I always think we're quite a forward-thinking clinic. We like to be kind of towards the cutting edge. We like to do more things. So yeah, we like to make sure we've got a lot of things kind of going on to keep us kind of busy and on the cutting edge, more on advanced. So I'm going to talk about 2 patients in particular. The first one is a 38-year-old female. She had sciatica and didn't realize, but she actually damaged her foot quite severely. So a mix between the sciatica and the injury to her foot and ankle meant that she just has neuropathy on her right foot. It radiates basically from the ankle down. There's very little feeling whatsoever. So what you do when you go on holiday, you walk on the beach, you get a bit of loose skin, you pick it, you don't dress it, and you end up with a lovely infection. So she was away for 2 weeks, came back with that lovely little wound. For about 4 or 6 weeks, she'd been seeing the GP and the practice nurse. That was the day before she came in to see us. So it hadn't really improved at all. It was very sloughy, quite smelly, huge amount of callus around it. Although it wasn't very deep, it was just in a really bad state. There was a lot of sort of redness and tracking going up to the ankle, although x-rays said no osteomyelitis, so that was all a positive. She'd only been given antibiotics, and the dressing she had was literally just a bit of gauze with tape over the top. So she came in after 3 weeks. We'd got it down from what was actually quite a big size, probably an inch, down to a couple of centimeters really. The sluffiness had reduced quite a bit. The smell was still there a little bit, but that had reduced as well. Although she did have neuropathy, she was having some pain. Obviously, it was not a nice kind of feeling for her, so a lot of time to get it back to normal. I apologise if you do like reading. I don't, so all my slides are basically just going to be me talking. So after about 8 weeks, we'd got the wound down to there. Very, not much slough. It was very clean. There wasn't quite as much callus around. The granulation was a bit more under control. We had, if anyone's wondering about dressings and things, we had used a mix of Actolite honey, occasionally Aquacel, betaine foam, and we had put her in a Keraped with kind of that area removed. Unfortunately, she is very much a gym bunny. She does not do well with being inactive. So she kept trying to go to the gym with a Keraped, despite advice not to. So trying to lift weights and run, it wasn't helping the situation, but we managed to kind of convince her to calm down and to give us the opportunity to let it heal. So after 8 weeks, we began the laser. Very quickly, you can see the dimensions, the diameter and the actual wound starting to close up. So it was never that deep, which is always a good thing. It was still through the skin down into more the soft tissue area, but very messy at the start. By the time laser was introduced, it was a bit stagnant for about 2 weeks. The wound edges hadn't really moved. We only introduced laser at this point because we just got the thing. We literally got it on, I think it was the Thursday. She was on the Monday, and she was one of our very first laser patients. So within 3 weeks, she had resolved down to that point. Still a bit painful, not as bad. We managed to get her out of a Keraped within a couple of weeks of this and back into her normal footwear with an adapted orthotic. So we then got to this. As you can see, the wound's actually enclosed itself. Still a bit fragile, but it had actually healed over very nicely. There was no pockets of sinus. There was no sort of deeper tissue damage. So we just kept it offloaded. We still managed to keep the laser in it. And very quickly, she was feeling a lot better, which is kind of the point. In the February, it looked even better still. The actual area, which was a bit more of a scar, had started to settle down. The little bit of sort of bruising was clearing up very nicely. Everything was looking much better. She was back to her activity in a much better way. We had a little bit of... Yep.
So did you say how many times you were treating per week?
Oh, we were doing 2.
Two. Thank you.
So she was in twice a week for the laser, basically. And that worked very well, actually, just to keep on top of it. And that was more for her peace of mind as well, rather than just us. So at this point, she had stopped wearing her orthotic because stubborn. But you can see the actual wound area itself was a bit more of a scar. It healed up really quite nicely. Just a small area. Within about a week, that was back to normal. No discharge, nothing had came from it. The wound was looking really, really healed over and maintained at that point. So even now, it still has a little bit of a scar, but we've had no breakdown and no issues for 6 months. She wants to come in weekly just because she feels better. So she gets laser weekly. We have a look at it. And yeah, she's had no issue. I actually seen her this morning and she feels fantastic. Trying to get her to wear an orthotic to offload it is a bit of a challenge. We have got her into wearing a bit more of a memory foam kind of offloading orthotic rather than anything functional. But yeah, generally it's been the lasers kind of healed it, kept it that way. Certainly the speed in which it healed after the initial kind of wound had sort of cleared up and the granulation had settled was quite remarkable. It was really fast and sort of healing up.
Right.
So, yeah.
Brilliant.
Currently, as I say, poor compliance with orthotics. We've just changed her skincare routine. We did have to kind of change her gym plan. So we've changed her more to less cardio and more weights and trying to get pressure off her foot, less impact. She was a bit hesitant and a bit resistant, but in the end, she's kind of went along with it, which is fine. So she still comes in for checkups and things, which, as I say, is more, it's more her decision than ours, but we're happy to accommodate, because for a young lassie, for something like this to happen, it's a bit traumatic. So, but she's thrilled with the outcome, especially as it's taken that long for anything to actually happen before she started coming in. So that's her currently. Patient 2 is an 88-year-old male, formerly high-powered engineering job. Whether it's just a Scotland thing, that's 2 stubborn patients I'm talking about today. Maybe other parts of the country won't be as stubborn as Scots, but you know, at the minute, yeah, I've got 2 stubborn patients. He's diabetic, fairly well controlled. He does the usual, oh, I don't need this bloody stuff, and you know, goes off on a bit of a harem scarum and does what he wants for a couple of weeks until his wife kicks him back into shape. I have been seeing him for podiatry care for about 7 years. About 18 months to 2 years previous to this, he lost both his second digits to wet gangrene. It was small blood clots, I think it was. One of them was definitely blood clots that had just basically restricted any sort of blood flow to the toe. So they both unfortunately were lost. We worked with the local diabetic foot clinic just to maintain him. At that point, we didn't have the laser, but both areas have healed well. His balance is poor. He has quite a bit of neuropathy. So we have been trying to help with that. So with this, he saw he had a sore area, put chiropody felt on, ripped the chiropody felt off, which is the nice little mark over there. So he done that about 10 minutes before I came in to see him. Quite a bruised area. When I started to debride it, the skin was kind of spongy, very wet, macerated underneath. Little bit of debris and things inside, but no infection. It was quite clean, which was good. So yeah, that's just a different angle, but as I said, he decided to self-treat, which is always great when you go in and somebody's done something that could have been prevented. He has, or did have, a pair of gardening shoes, which were basically attached to his feet. The damn things were 20 years old. He didn't tie them very often. He just slipped them on at the back, didn't even put his heels in. So this, I think, had been caused by very worn out shoes, which he wore all the time in the garden, and no matter how many times he'd been told, chuck them out, he didn't. They are now thankfully in the bin. So I done the treatment, ran down to the clinic, packed up the laser and brought it up. So we tidied it up, and 2 weeks later, that's how it looked. If anyone doesn't have the laser, the unit itself, or certainly the unit I have, is portable, and it comes with a very snazzy little case, so you can actually take it around. We have transported it to some of our wounds who are stuck at home. We've taken it home to do laser on ourselves if we've had pain and really can't be bothered staying at a clinic past 5 o'clock on Friday night. It's quite transportable. They give Celtic SMR give you all of the equipment to keep it safe if you do transport it, although it's probably better to stay in the clinic. But if you are considering the laser, just so you know, you can transport it around a bit. So 2 weeks later, it was actually encased and covered. As I said, he'd had an issue with his second digit, that taken 6 months to heal on the right, maybe a bit less on the left, about 4. So he's actually quite a slow healer. So to introduce the laser, and within 2 weeks to have that resolution, 4 weeks we were down to that. As you can see, not much bruising at all, in a much better condition. Cannot convince him to use emollient on his feet at all, but that's another issue. Within 5 weeks, you could hardly tell anything was there. It was really good at resolving this issue with him. He did take a little bit of cajoling to say, I'm going to get the laser, and I had the usual, will it hurt? Is it going to be sore? Will it be okay? Can I walk on it? Can I go in the garden? Very easy to get around it, and after the first time, he's very happy. If I ever say, I think you'll need the laser, we're actually talking about it for the edema function in his leg now. So I'm working on that. While I mentioned edema function, it works very well. Within 8 weeks, negligible there. Again, we have just popped him into a bit of a offloading insole. It's the Cedus memory foam we've used. Dressing wise for him, I just used a bit of biotin and Aquacel to dry it up with Alpha Silver after a bit of debridement. But yeah, he resolved very quickly, and as I say, not the best healer at all. I see him weekly at the minute as well, not for any reason to do with him. It's I see his wife for acupuncture. She has had cold hands and feet, so I go in, and every time I come in, he sits there with his foot out and goes, right, you can bloody well look at this again. So we keep him on his toes. He's fine now. Doesn't follow his advice well, but at least we've got a bit more resolution with him, and he seems to be a lot happier. He didn't have much pain, but to be honest, he was noticing it was uncomfortable. He knew there was something there, which is why he put the chiropody felt on. One thing I will mention for both these patients, because they have a bit of neuropathy, we have been doing what is actually our setting for the shoulder. It's brachial neuralgia. So to try and stimulate a little bit of nerve supply, and we use that around about the lateral malleoli in particular to try and increase nerve supply. Certainly the first patient, patient 1, the younger girl, is feeling things in her feet for the first time in about 2 years. Not perfect. If she stood on a thumbtack, she might not notice it for an hour, but certainly she's getting, you know, tickly feelings, which she hasn't had in a long time. So that's a good resolution there. In our clinic, we use it for everything. MSK, it is very common. We'll be using it. As I said, you know, the other day we had 4 people fighting over the laser at the exact same time. It is that popular. Roughly 13% of our just individual appointments are for laser or acupuncture only, which is not bad. When you include the patients who are coming in for either other MSK appointments, we use laser on. Dressings, almost every wound or dressing now, we use laser. And we occasionally have somebody who comes in for podiatry treatments and they'll have a small pain, whether it be a little bit of plantar fasciitis starting, possibly a Morton's neuroma. We will use the laser. So 22% is probably a low estimate on the amount of times it actually gets used in our clinic over a day. Certainly this morning we had 12 appointments and 5 people had the laser. So it's very effective. When it comes to wound healing, which is what you want to hear, after nail surgery, we've reduced healing times from average of 6 to 8 weeks to about 4 to 6 weeks. I would lean more towards the 4 to 5, but it's better to give a window. So yeah, it's dramatically improved the wound healing times, particularly post-op nail surgery. And as I say, in other wounds as well. We have been the first clinic to add the autonomous Charlie head, which we love. In our clinic, we've been able to shave off about 8 to 10 minutes per session with it. So if you think of it that way, the amount of times we use it, let's call it 25%. If we can save you know, 10 minutes per session with, compared to using the handheld probe, it generates probably an extra appointment a day between the 4 rooms that are working on the day. That's obviously a benefit to you financially and longer term as well. We also get probably, I wouldn't say better outcomes, but it's certainly, the speed seems to be good, works for us, and it's very handy if we want to do 2 areas. So if somebody has came in for nail surgery, dressing, and they've also been in for, call it, knee pain, we've been able to set the Charlie head to do their knee pain, and we can do the quick post-op nail surgery dressing as well, and laser that area all at the same time. So time-wise, having the autonomous head makes a big difference to us in clinic, especially considering how often we use the laser. But this is one that we've been trying. I know it's not what you came to hear about, but I will talk about it since a few of us will be podiatrists anyway. Fungal nails. Steve was talking to me and passed me the protocol. As soon as you say something to Phil in our clinic, Phil decides to try it. So that's Phil's lovely green shoes at the top. He decided to give it a bash. So this was a lady came in with fungal nails. The protocol is 1500 hertz for 5 minutes, 30 seconds at 100% intensity per nail. So you have to put, if you've listened to Paul at any time, it's the joules, it's the amount of energy you put in that you really want to concentrate on. We did fenestrate in the first appointment as well, but the patient hasn't actually been using the Clinicept that we sold them. So the photos are without the fenestration actually being used. I only found that out this morning when I was asking about it. So presentation might not be quite as accurate as it should be. But yeah, so for the 2 big nails, it was about 10, 11 minutes really in time. What you do is you would have them in for the first time, treatment again an hour later, and then you repeat that cycle for 5 days in total. At 2 weeks, you'll review it and repeat every 4 weeks. What the aim seems to be from the literature is to prevent the fungal spores from growing. So it prevents reinfection and spread further down the nail. Again, I'm going to sing the praises of the Charlie head. It has taken 5 minutes, 30 seconds per nail to 1 minute 30. Now, obviously, if you're a podiatrist, time can be money. So if you can really shave off some time in the amount of treatment, it makes a huge improvement. So there you go. You can see the nail from there being quite fungal all the way down. You can actually see a little bit of improvement. The nail's growing. It's quite a slow growing nail anyway, to be honest, but you can see not much in the way of reinfection. That was about, I think that was about 3 or 4 weeks ago. So she's due in again next week. But she's pretty happy, and certainly when we're looking at it, there's not much fungal nail debris coming away. It looks much, much improved. So what do we think of the laser in our clinic? That is the lovely Joanna with our new Charlie head, and that is actually patient 1 that was spoken about. We love it. For us, apart from adding our team, as I say, it has been the single best thing that we have in the clinic. We use it multiple times per day. It is probably harder working than me in the clinic. That's not even a close, that does more work than me in the clinic. It is by far and away the best purchase we've got in the clinic. So I hope I didn't bore anyone. I hope everyone's still awake.
I'm absolutely sure you didn't. That was amazing. That was really interesting, Adam. That was amazing. Thank you. Really, really interesting. I think there's a competition going to have to come. We're going to have all our users style out the glasses, and we'll have a...
I put that in because you do ask everyone to do it. I think you asked...
I need selfies of the users styling out the glasses, and there's 100 free leaflets to the winner. I'll be the judge, though. So anyway, that's one for another.
Paul's already winning.
Paul, they're in the post, mate. They're in the post. What can I say? Everybody else, don't bother entering. So that's great. That was great. Thank you. There are 1 or 2 questions coming in. I'll use this as an opportunity to encourage more to come. We've got plenty of time to get more questions in. There was a question specifically on the treatment, and I think this came in on when we were looking at patient 1, but I don't know if it would, let's get it on patient 1 and 2. We asked about the treatments, how many treatments are used per week. The settings, what about the settings? Was that straightforward, the same for both?
It's very simple. When you, as I say, we've been seeing patient 1 twice a week initially because it was horrendous. So once we got on top of that, we've scaled it back to weekly. We have tried saying, what about 2 weeks? What about a month? And she's very much not happy with that at the minute. She's quite happy coming in weekly. We're happy with that because it lets us do the brachial neuralgia setting if we don't do anything around the wound at all. So yeah, that works very well. The setting, the laser itself has a wound healing and an ulcer setting, which are both the exact same, but it does have both. All you do on it, it's very basic, which suits me so much. All you do is set to roughly the size of the wound. So the first one was, first time we've seen her and we're lasering, you do about a 3 centimetre gap around the wound. Or certainly that's what we read in the literature, so 3 centimetres from every edge of the wound when you're doing it. So you sort of estimate the sort of rough size. It comes in a square centimetre size, so a little bit of maths conversion for you, but you can just find a nice simple way. Google's quite handy if you're after anything and you're a bit lazy like myself. So yeah, we sort of estimate or measure the size of the wound, get the rough square centimetre size, and then do about 3 centimetres around as well, around where the periphery is. It's 1500 hertz at 75% interval, I think it is, for the wound healing. I might be wrong on that. It is right behind me and I could check, but I might not.
We can follow up as well and make sure that.
It'll take me 2 seconds. But yeah, so it's 150 hertz. As I say, it's dead simple. All you do is change the size. So let's say you go to 10 centimetres, that's about a minute. So you can do the whole 10 centimetre square area with the handpiece in roughly a minute's time. It's excellent. And that
leading question, but I mean, obviously the laser obviously got its protocols in there. It's pretty self-intuitive.
Yeah.
With it, you can override at any point, and Paul can talk a little bit more about that potentially. But you can override at any point, but equally follow the machine settings, right?
Yeah, it's 1500 hertz at 100% interval, and all you do is just change the square centimetre area for what you want to do. If you use the Charlie head, the autonomous head, the power setting stays the same. It's 1500 hertz, and still 100% interval. But if you change the area, the amount of time will come down. So I'm just going to say 10 centimetre area for both. So that is 1 minute 36 with the lovely Charlie head, and with the handpiece it is 48 seconds. So that one's a bit quicker, but yeah, it's really intuitive, really easy to use, to be honest.
And again, just for clarity, the Ultra Head and the handpiece, they're 2 different channels. So this is not so much a question, this is more for the audience. They're 2 different channels, so you can set them both up separately. They don't have to both run at the same. So that's another thing for clarity there. You can have 2 things going on at the same time.
Yeah, as I say, you can sort of do, if somebody comes in with a wound or something, you can do wound on one foot, you can do plantar fasciitis on another. It's very easy to use both. Lots of good results using both settings actually at the minute. And it's quite handy if we've had somebody with a hamstring, we've had the autonomous head on the hamstring, and we've been able to do sort of the lower leg, whether it's more a tweak in the calf or something, we've been able to use both at the same time. As I say, just cuts your time down.
Yeah, brilliant. There's a question actually came in from Gareth. I think you've covered it. So just to be clear, treatment applied around or over the wound?
Yeah,
around or over?
You do it over as well. don't touch with the end piece. We just don't touch when we're doing over the wound, just for infection control reasons. It still works. You just keep it a little bit off, but you can go around as well. As I say, about 3 centimeters around.
Brilliant. Okay, a couple of comments and a question from Marissa. Impressive results. So that's good. Thank you, Marissa, for your feedback. Hi, Adam. Have you tried the laser to treat chronic edema? Example, lymphedema.
Yes. Very good results. There is a anti-edema setting pre-programmed into it. We have had very good results. There was somebody, Joanna was saying, her legs came down, we measured it, it was about 6 centimeters due to the edema in the diameter. It might have been 4 or 6 centimeters in diameter, so, and they look a lot better as well. So still a bit uncomfortable for her because it is edema, but that's only early days improvement. So as it goes, we've been experimenting more with edema, and it has been very efficient.
Brilliant. There's, I was talking to our colleagues over in Australia, Heal Laser. They do some really good webinars as well, guys. Look out for them. And they're doing some trials on lymphedema specifically. They've promised to keep me up to speed on how that goes. We're going to do a few more trials and get more feedback on the fungal nail side of things over here. Got 1 or 2 people I'm looking for volunteers for on that. So we're going to keep them in the loop. We'll share with our Australian cousins the info on the fungal now, but we'll get some good information back on the lymphedema. So it's just going to add, it just really does add to the flexibility of this machine, really. Okay. Paul, anything you want to add for anything like that? I know Adam mentioned then the benefit of using the Ultra Head as well. I know you have the Ultra Head for your physio work. Anything you want to add?
Well, I'd just like to say, well done, Adam. I think some of those photos were just epic. And it really does show how effective the laser is. I'm very lucky. I don't often deal with ulcers or anything like that. I'd be sick most of the time, I think. But it just shows you're getting this on there. You're doing something which people can't normally do. And I've heard so many stories of people having wounds, ulcers, especially if you look at a diabetic, the diabetic person with the wound. You've got to understand as well, there is really reduced peripheral circulation in there. And the fact that you can still get these changes so rapidly is pretty phenomenal. I was going to just mention one thing. If you look at, if you're using the Charlie head, the multi-diode applicator on a wound or anything like that, you'll see if you do the settings, there's quite a big difference, because what I tell people when we're doing the just with the wand, what is very important, you can often mess around with settings and change things and get more power in, depending if it's more acute or more chronic, get more power in and everything like that. It's always effective to get more joules in. What we have to be aware of in biostimulation is keeping within a certain parameter. And it really is, if you're using the handpiece, it's 1 to 4 joules per square centimeter, which is going to cause the granulation, and you're going to get the changes. Now, if you put the settings in for the biostimulation into the Charlie head, you'll see it's actually quite a bit higher. So you think straight away, isn't that going to be a problem? Because you're going to stop the granulation and do the opposite. But you're not, because what's happening is you'll find generally that the Charlie head settings will be quite a bit higher, because it is placed at 20 centimeters away from the wound or what you're treating. And you actually lose some of the power which goes into the tissues from that distance. It's focused to treat that large area at 20 centimeters. But what's happening is you are losing a bit of the power, and that's why the power is so much higher. But don't mess around with that. Don't think, oh, well, that's higher, so let's stick a bit more in there. Because you want to keep it in that area, because the granulation will occur in the area they give you. They haven't done this and made it up. it is a very important level. Every other thing you can pretty much mess around with and try depending on the results. You will not be able to do that with the biostimulation, because we need it in that area. But when you do it in that area, it's phenomenally effective. And I suppose the only thing I wanted to ask you, Adam, was you mentioned about you do a bit of acupuncture, and I do acupuncture, but have you ever used the Charlie head over the needles?
Yes, with good results.
It's pretty amazing what you can get. The only problem I have with doing that is it's very difficult if you're trying to assess was I just brilliant that day at acupuncture, or was the laser really helping? And you can't. That's the problem.
It was the laser.
Sorry?
It was the laser.
It was the laser. Okay. you do get phenomenal results. I suppose you could just have a large-scale study with people just getting the laser and getting the needles, and then one with both together, and see over a big group, big cohort, what the difference is. But I'll tell you from anecdotal, personal changes, if I get my needles out, that Charlie head is right over them straight away. And I don't know if I'm very good at acupuncture. I don't think I am. But it's brilliant. I get great results.
Well, let's do that. Let's do one with and one without. Let's get something.
Well, yeah, we need more than that. We need.
We do.
Something a bit too small scale, and we couldn't really send a paper in. They would chuck it out straight away. No, but we could get enough people. We could do something quite good like that.
Yeah. Thank you. Great. Sorry, Gareth, I missed the question earlier about verrucas. Not effective verrucas, unfortunately. Hey, we do everything else. We do everything MSK. We do edemas, biostimulation, fungal nail. Joke for all the podiatrists out there, maybe get some tea tree oil, that should do it. That's the only thing that can treat everything. So, yeah, no, not effective in all honesty, for all joking aside, for verrucas. Okay, Leonie. Hi, Leonie. Any experience with treating psoriasis? Paul, Adam?
I personally haven't used it on the psoriasis plaques itself, but I have used it again with monumental changes on psoriatic arthritis. You'll generally get somebody who's got psoriatic arthritis. They'll actually it is more often than not that the person with psoriatic arthritis has much less plaques than the person who's got just a bad case of psoriasis, and you see it all over their body and everything like that. This one patient with psoriatic arthritis, she's got a few plaques just in the top of her head. You can't see them, and a few down in the underpant line. But she's got psoriatic arthritis. It's a nasty, nasty disease. It is part of the rheumatoid arthritis family, an autoimmune problem. It's the same as rheumatoid arthritis, apart from you don't have rheumatoid factor, you don't have HLA-B27 raised, but it has to be diagnosed by the rheumatologist. What happens is she's on fairly large levels of methotrexate, which controls it. But this is a pretty nasty drug, really affects your autoimmune, it reduces your immunity system, because the autoimmune system is the problem. That is what's eating you. So she had a big flare-up with on her knee in agony. Now, what she would normally, or what she's done in the past, and it's very distressing for her, she has to then try and get the appointment with the rheumatologist. What they do is they up the methotrexate, so it takes a bit of time to come into effect, and then what they do is they they aspirate absolutely huge amounts of fluid from the knee, which again in itself is distressing. She came to me, she said, look, I just don't think I can go through that again. I said, come in. And what I've used in conjunction, it's another thing which ACER do sell. I sound like a salesman here, but I'm not. But we have the magnetotherapy table here. Half an hour on an osteo setting of 15 hertz, and but put the percent up 90%, half an hour of that, and then just some laser. The difference was phenomenal. She was ringing me up the next day crying, saying, I can't believe it, what a difference it's made. And so I think, you know, in situations like that, we should try this out more, because psoriatic arthritis, horrible disease. As I say, I haven't used it on the plaques, and I can't give you any anecdotal evidence whether it would actually help with the plaques. Adam, any idea on that?
We started trying it on a couple of people who have had like red psoriatic areas, just to sort of see if it does anything. We are very early on in trying it. We are just, it certainly looks reduced. We did have somebody in the other week who had quite a bad case of fungal infection on the foot. So when that had cleared, because he'd been given steroids, the skin was paper thin, very red, very shiny, almost hard to touch, to be honest. So we've started using it just a little bit on there, just to see if that will make much improvement. Certainly the last time I seen him, which was Wednesday, it looked a lot better. So whether it's just the case we've got the fungal under control and the skin's repairing, or whether the laser's helped, I would say it's helped. Certainly if we're trying to do sort of more skin repair, tissue repair through the wound settings. So yeah, we're experimenting with it, put it that way.
Brilliant.
Whether I'm going to tell Steve that, I don't know, but you know, it might be out of what you've gave it to me on Soulmate for, so you know.
It's a great question, Leonie, and it's obviously got us thinking, and it's an interesting topic. So what I'll do is we'll keep the conversation going. I'll talk to ASA, and we'll see if they can add anything to the conversation. And you know, on the usual platforms, let's keep talking, keep sharing. What we've got here, Julie.
Sorry, Steve. Can I just say something towards that? My guess would be that it's not going to clear up your psoriatic plaques. For the very simple reason, we're not really talking about granulation in this situation. What it might do, and I imagine it definitely will do, but you have an awful lot of inflammation from those plaques. And with what's going on with the Scott Sigmund and the use of the Charlie head on the COVID-19 patients, which is being used to reduce the inflammation in the floor of the lungs, I presume it would actually probably calm down some of these plaques enormously and make people more comfortable anyway. But I don't think, it's an autoimmune problem, this. I don't think it's going to, like the laser is not going to cure rheumatoid arthritis. It will alleviate the symptoms to such an extent, it's extraordinary, but it's not gonna cure your rheumatoid arthritis.
Brilliant. Okay, thank you, Paul. That's great. Adam, anything else?
No, I hope we've covered everything for everyone.
Listen, what I want to do now is I'll keep an eye out for any comments, any feedback and comments, guys. Drop them on chat. Any questions, get them in now while you can. I'm just going to mute one of my friends here, Kirsten Sinclair, who's there. Are you? Hi, Kirsten, how are you?
I'm fine, thank you.
Brilliant. How's Priscilla?
Priscilla is very busy. She's keeping us going.
Brilliant. For everybody out there, if you want to know who Priscilla is, drop me a message on chat and I shall send you a little story about Priscilla with you. But how's the laser doing?
Good, yeah. It's really good. I think we've reached that kind of word of mouth type momentum now, and people are contacting us just going, would the laser work for this or would it work for that? So it's really good when it's kind of coming to us and we're not having to chase it. Yeah, good.
That's great. And that's an interesting one. The reason, guys, why I've picked on Kirsten, well, it seems like I've picked on Kirsten. I've just introduced Kirsten because Kirsten's kindly going to do one of these webinars for us in the near future. So I just wanted to introduce Kirsten. Kirsten's got one of our lasers. And Kirsten is going to talk about, let's call it return on investment. Is that right? We haven't quite given it a title yet, but revenue in the clinic.
Yeah, yeah.
So Adam's touched on it a little bit today. A brave person to come on a webinar with predominantly podiatrists talking about return on investment. That's a brave person. So thank you for volunteering that. But no, all joking aside, it's a big thing to consider. So we're really, really grateful, and it's easy for me to just harp the salesperson to harp on about the benefits. It's great when we hear it from people that are in the coalface and getting the benefits of the laser for real. So that was a very quick introduction for Kirsten. So that's why we did that, and that's what we're going to do next. We're going to have more webinars with Paul, where we're looking at specific topics, pathologies. Every other week, we're going to do those on our Wednesday slot. Hopefully we'll get Adam back again. I'm sure he's going to be wanted to be back again. I'm sure popular demand will have Adam back again, maybe looking at some more case studies in the future. And as I say, not too far in the future, we'll get Kirsten on here talking to us about her experiences or her clinic's experiences of you know, how it's benefited the clinic in general, you know, from a revenue point of view. So thank you, everybody. Big thank you, of course, today specifically to Adam. Really, really grateful for taking the trouble to share that with us, and some good knowledge passed on there. Really, really grateful. Thank you, Adam.